Bismillahirrahmanirrahim. I am Dr. Mohibullah Wazir, and the topic is the great Saphenous vein, or also long Saphenous vein. Great Saphenous vein or long Saphenous vein. Look over here, please. This is the dorsal venous arch of the foot. These are the dorsal metacarpal veins. These are the dorsal digital veins. Look, the long Saphenous vein or great Saphenous vein, it starts from the medial margin of the dorsal venous arch, and after the uniting with the medial marginal vein of the big toe, then this long Saphenous vein ascends upward just anterior to the medial malleolus. And note this point, that over here the long Saphenous vein lying just anterior to the medial malleolus, it is very easy accessible. And note the point, if a patient comes in a shock condition and all the veins are collapsed, what you do? Just look over here, just in front of the medial malleolus, you give incision to the skin, open the skin, and just deep to the skin, and in front of medial malleolus, you will find the great Saphenous vein. This is called as venesection, and this is a very emergency procedure, and every doctor should know it, so that in emergency condition you do venesection and you cannulate the vein so that you can give the life-saving drugs or the fluids or the blood through this vein. Okay, then this great Saphenous vein ascends upward along the medial side of the tibia or medial side of the leg. And then note over here, look, it ascends upward along the medial side of the tibia and then passes at the posterior side of the tibia and at the knee. Note the point, it passes somewhat one hand breadth behind the medial border of the petal, that is behind the knee, and then it turns or winds around along the middle side of the thigh and again comes in front of the thigh. And over here it lies on the deep fascia. You know, over here the muscles are called by a thick deep fascia, which is called as fascia lata, and the vein like this over here. Please note, these are muscles. Let me say, this is the deep fascia. The vein lies over here on the deep fascia, while this vein, which you can see, which is called by the deep fascia, this is the femoral vein. And now over here, there is an opening in the deep fascia, which is called as Saphenous opening. The vein passes through the Saphenous opening and ultimately it opens into the femoral vein. You can see it over here, please. From behind the knee, it winds around the middle side, comes anterior in front of the thigh, and over here you can see this opening. Make it clear. This is the Saphenous opening, and the vein passes through the Saphenous opening, which is an opening in the fascia lata, and enters into the femoral vein. This is the course of the long or great Saphenous vein, and this Saphenous opening, it lies 3 centimeter below the inguinal ligament and 3 centimeter lateral to the pubic tubercle. Over here, it lies over here 3 centimeter below the inguinal ligament and 3 centimeter lateral to the pubic tubercle. Over here is the Saphenous opening. Okay, And over here in the leg, you note this great saphenous vein is accompanied by the saphenous nerve. You can see it. Saphenous nerve accompany the great saphenous vein. Now, this great saphenous, long saphenous vein, it has many veins, somewhat 10 to 20 veins present in the great saphenous vein. And these veins, as you already know, these are unidirectional veins. Note the point. These veins are unidirectional. That is, it allows the blood from the distal to the proximal or from the inferior to superior part, but it do not allow the blood from the proximal or from superior to the inferior side. In this way, the venous return is being established. But if these valves become incompetent and the blood comes back from the superior to inferior side, then this long saphenous vein becomes abnormally dilated, which is being called as varicose vein. And one vein is so there are many veins which are unidirectional, and one vein is usually present over here at the saphenofemoral junction, where the saphenous nerve vein open into the femoral vein. One vein is always usually present over here. Okay, now what are the tributaries of the great saphenous vein? Note, important point. Again, note that the great saphenous vein is clinically important vein. What for? Number one, because it is the common vein that get varicose or abnormally dilated. And number two, this is very long vein or longest vein in the body, and this is being used for grafting, for vascular grafting. For example, in bypass operation of the heart, coronary artery bypass grafting, this vein is used because it is very long, and rather it is longest vein. Because of this reason, this great saphenous vein is clinically important. Now, what are the tributaries of the great saphenous vein? Look, this is the femoral vein, and this is the great saphenous vein. Before the great saphenous vein, it passes through the saphenous opening. Before it passes, it receives over here usually 3 veins, maybe 4 veins. And these are important clinically. These veins are, number one, you can see superficial epigastric vein, and number 2, superficial circumflex iliac, and 3, superficial external pudendal, and maybe deep external pudendal. Note, look, this is the femoral vein, and over here, if this is the great saphenous vein, so one vein passes over here, this is superficial epigastric. One vein passes through the anterior superior spine, that is superficial circumflex iliac. One passes medially, that is the superficial external pudendal, and maybe deep external pudendal. Note the point. During surgery for varicose veins, these 4 veins must be tied before you remove the great saphenous vein. If any vein remains untied, and if you remove the great saphenous vein, the patient may come with a big hematoma over here. That's why these 4 veins must be in your mind, and you remove, and you first tie these veins, then you do the surgery and remove the great saphenous vein, which is varicose. Another point you note it over here, please. Look, if this is superficial circumflex iliac vein, look, This is superficial circumflex iliac vein, which opens into the great saphenous vein. The great saphenous vein opens into the femoral vein, and the femoral vein opens into the external, the external iliac, and ultimately into inferior vena cava. And over here there is lateral thoracic vein. This open into the axillary vein, and axillary vein open into the superior vena cava. Over here, one vein that unites the superficial epigastric with the axillary vein, that is called as thoracoaxillary. That is thoracoaxillary vein. This thoracoaxillary vein make connection between the superficial epigastric vein and the lateral thoracic vein, and in this way the great saphenous vein is ultimately connected to the axillary vein, and the axillary vein open into the superior vena cava, and the great saphenous open into the inferior cava, and in this way, through this thoracoepigastric vein, the inferior vena cava is ultimately being connected to the superior vena cava. Okay, all right. The other tributaries of the great saphenous vein are, you look over here on the medial side, that is one vein which we call it accessory saphenous vein, and on the lateral side where there is another vein in front of the thigh which call it as the anterior femoral cutaneous vein, this, and then over here at the foot, as I have already shown you, the medial marginal vein of the big toe, and then there is another vein which is called as posterior arch vein. Aji? Posterior arch vein also, and then branches from the common femoral vein and from the small saphenous vein also. And also note the point that the great saphenous vein is being connected to the deep veins. The great saphenous vein, you can see over here, the great saphenous vein, its course, it is connected over here by these perforator veins to the deep veins. This I will discuss a separate topic, but note medial marginal vein and then many perforator veins and connection to the small saphenous vein, and these perforator veins, they take the blood from the great saphenous vein to the deep veins. It also have unidirectional valves, and if these will become incompetent, it also result in the varicose veins. The perforator veins I will discuss separately. This is all about the great saphenous vein. Thank you very much.